Why do some wounds smell bad? Most people think if a wound smells, it automatically means it's infected. But the truth is, not every smell equals infection. If you've ever cared for someone with a wound that had an odor, you know how much it can affect not just the healing process, but the person's dignity. Which is why in this video, I will explain the main reasons wounds smell, what those smells actually mean, and most importantly, what you can do about it. For those who don't know me, my name is Dr. Cassandra Voltaire. I'm a family medicine physician trained in wound care, and I've taken care of thousands of wounds, some that healed quickly and some that were incredibly complex. And yes, plenty came with smells people were too embarrassed to even talk about. So if you're a nurse, a caregiver, a provider, or even just someone curious about wound healing, you're in the right place. The first reason wounds smell is bacteria. When bacteria break down tissue, they release byproducts that have strong odors. Think of it like food in your fridge. If meat spoils, it doesn't just look bad, it smells bad. Wounds work the same way. When bacteria overgrow, odor is often the first clue. But here's the catch. All wounds have bacteria. The skin is never sterile. So the question isn't whether bacteria are present, it's whether they're causing harm. This is where biofilm comes in. Biofilm is like a protective shield bacteria build, and it can trap waste products that smell. If you don't disrupt that biofilm, the odor can linger even if the wound doesn't look obviously infected. The second reason is necrotic tissue. Dead tissue, especially slough or eschar, has its own smell. It's like having compost sitting in the wound bed. The body can't move forward with healing until that material is cleared out, and the longer it sits, the stronger the odor becomes. This is why debridement, removing dead tissue, isn't just about appearance, it's about function. It removes the source of odor and gives the wound a fresh start. Learning more about this together is actually one of the reasons I built the wound care circle, because so much of wound care is about connection, learning from each other, sharing what works, and not feeling like you're managing these complex wounds all by yourself. Inside the community, we talk through real cases just like this one. You get to hear how other providers are handling the same challenges, and you realize you're not alone in this. You can access the link below. The third reason is drainage. Not all drainage smells, but certain types, like thick, purulent exudates, can definitely give off odor. Even heavy serous drainage, if it soaks a dressing and sits against the skin, can start to smell because of the moisture imbalance. I remember a patient who came in with a wound on his shin. His biggest concern wasn't pain, it was the smell. He said he was too embarrassed to go to church because he thought everyone around him could smell it. When we took the dressing off, the wound wasn't infected, it was just constantly draining, and the dressings were getting saturated and staying wet. Once we switched to a more absorbent dressing and started compression for the swelling, the odor disappeared in a week. It wasn't necessarily from infection, but from the moisture management. The fourth reason is fungal or mixed microbial activity. Sometimes odor isn't from bacteria alone. If the skin around the wound stays moist, yeasts can overgrow. That creates a sour, musty smell that's distinct from the rotting smell of necrosis or the foul odor of heavy bacteria. This is why it's so important to not just look at the wound bed, but also the periwound skin. Redness, scaling, satellite lesions. These are all signs yeast might be contributing. The fifth reason is more systemic. Certain metabolic conditions like advanced kidney disease can alter the way wounds smell. It's subtle, but if you've been in wound care long enough, you start to notice patterns. This doesn't happen often, but it's a reminder odor is a whole body signal, not just a wound bed issue. So now that we've covered the main reasons wounds smell, what do you do about it? First, don't just mask it. Air fresheners, perfumes, even heavily scented dressings can hide the smell, but do nothing for the cause. Always ask, is this odor coming from bacteria, necrosis, drainage, fungus, or something systemic? Second, treat the source. If it's bacteria, consider cleansing and debridement. If it's necrosis, think about how to safely remove that tissue, whether it be autolytic, enzymatic, sharp, depending on the patient. If it's drainage, focus on absorption and compression. And if it's fungal, treat the skin. Third, support dignity. Never underestimate how much wound odor affects people socially and emotionally. Patients may withdraw, avoid family gatherings, even feel ashamed. Even simple steps like charcoal dressings or odor-controlling products can make a huge difference in the quality of life while you address the root cause. I had a woman in her 60s with a large venous ulcer. When she walked into the clinic, the smell hit the whole room. She was mortified. She kept apologizing. The wound was draining heavily with slough and some early biofilm. Here's what we did. We explained that this wasn't her fault. It was biology. We cleaned the wound thoroughly, started compression, and used dressings that could absorb fluid and control odor. Within 2 weeks, the smell was gone. Within 2 months, the wound was closing. That day taught me odor is often a sign of imbalance, not failure. And when you rebalance the wound environment, you not only help it heal, you give the person back their dignity. So let's close this out. If you've ever cared for a wound that smelled bad, remember this. Odor is a signal, not a sentence. It can point you towards bacteria, necrosis, drainage, yeast, or something systemic. And when you figure out the cause, you can take steps that actually change the outcome. The hardest wounds to treat are the ones that ask you to juggle competing truths. You can't push too hard in one direction without causing harm in another. And that takes patience, humility, and sometimes the courage to say, we need a team. But just knowing why some wounds smell bad is only step one. If you knew how to clean these wounds the right way, it allows them to heal much faster. And there's actually something that I started doing recently that's helped me speed up the time it takes for wounds to heal significantly. So watch this next video where I show you what it is, how it works, and how you can use it to treat your patients faster. Stay informed and heal well.